All right, let's get right into it. Trying to manage high blood pressure can feel a lot like solving a mystery. You've got this number, but what's the real story behind it? Well, every investigation has to start somewhere, and for this one, it begins with a conversation. Today, we're going to crack the case of why that conversation is just so important. You know that feeling, right? You walk in for what you think is a simple checkup, and suddenly you're on the hot seat, answering question after question about what you eat, your parents' health, how you sleep. It can feel a little intense, but I promise there's a really, really good reason for all of it. And that's the absolute key right there. Your doctor isn't just being nosy or trying to fill out a form. They're stepping into the role of a health detective. Every single question is a tool to uncover a clue, and your personal story? That's the case file that holds all the secrets to solving your unique health puzzle. So let's call this what it is, the hypertension investigation. The mission here is to build a complete picture. This isn't about just throwing a pill at a number on a machine. No way. It's about truly understanding the whole web of factors that got you to that number in the first place. You know, any good detective starts by reviewing the existing evidence, the case file. And for your doctor, that means digging right into your health history, both what's happened in the past and what's going on right now. This is the bedrock of the entire investigation. First things first, they have to establish a timeline. When was the last time your blood pressure was actually normal? How has it been trending over time? This helps them figure out the nature of the case. Is this a recent thing that popped up out of nowhere, or has it been slowly creeping up on you for years? That context is absolutely crucial. Next up, they're going to look at what's been tried before. What medications have you already been on? How much were you taking? Did they actually work? And a big one, did you have any side effects that made you just stop taking them? See, this isn't just ancient history. It's vital intel. It helps avoid repeating what didn't work and points the way toward what just might. Now, a smart detective knows it's rarely just one culprit. They always look for accomplices, and when it comes to high blood pressure, your daily habits and your lifestyle choices, well, they can be major players in this whole mystery. And you'd be surprised what can act as a secret agent working against you. We're talking about things that can push your blood pressure up without you even realizing it. It could be common over-the-counter pain relievers, certain prescription meds, or even stimulants. Finding these is like discovering a hidden accomplice hiding at the scene of the crime. And then, of course, there's the dietary footprint you leave behind. Your doctor's going to ask about salt, how much you're getting from things like processed foods. They'll ask about alcohol, about saturated fats. Each of these things leaves behind a very distinct clue as to what's fueling the problem. And this slide just lays it out perfectly. It's like the two sides of the coin in this investigation. On one side, you have the risk factors, the accomplices, like smoking or being inactive, that just make the whole case harder to solve. But on the other side, you've got these powerful protective factors, like getting regular physical activity that can be a huge ally in your defense. So here's the bottom line. It all comes down to this. Your day-to-day life is where all the most important clues are found. From the supplements you might take to the afternoon walk you decide to skip, it all fits together in the big picture puzzle of your health. An experienced detective knows that some clues, well, they're inherited. And that's exactly why the next step is to follow the genetic leads. And that means taking a really close look at your family's health history. Think of this as your family's genetic blueprint. Did your parents or siblings have high blood pressure? What about early heart disease, diabetes, or even specific kidney issues? These are powerful, powerful clues. They help the detective figure out if you're predisposed to certain conditions, and that can change the entire game plan for your case. Okay, now the detective work gets really active. It's time to start searching the scene, your body, for physical clues. These are the symptoms you might be feeling that could point to a much deeper cause, or maybe even reveal the impact this high blood pressure is already having. This brings us to a really critical question in the investigation. Is it possible that high blood pressure isn't actually the main problem? That it's really just a symptom of something else going on under the surface? This is what's known as secondary hypertension. And these are the kinds of subtle clues your doctor is listening for. Things you might not even think are connected, like muscle weakness or sudden spells where your heart races and you get all sweaty, even changes in your skin. These seemingly random symptoms could be pointing to a hidden culprit. Maybe an issue with your kidneys or adrenal glands that needs its own separate investigation. So the next line of questioning is really all about damage assessment. You see, high blood pressure is often called the silent killer because you don't feel it. But a good detective is always looking for evidence of its impact on the body, what doctors call target organ damage. So, when your doctor asks about things like headaches or shortness of breath, or maybe even fleeting changes in your vision, they're not just making small talk, they're actively searching for this evidence. These symptoms are like bright red flags, telling them that the high pressure might be starting to strain vital organs, like your heart, your brain, or your kidneys. And we have to talk about this one, a huge and very often overlooked accomplice: sleep apnea. If you're a loud snore, if you feel exhausted all day even after a full night's sleep, or you wake up with headaches, that could be a massive clue. Untreated sleep apnea can make blood pressure incredibly, stubbornly difficult to get under control. Okay, so after all that digging, all that information gathering, it's finally time to solve the case. The detective takes all the clues from your past, your lifestyle, your family, your symptoms, and starts putting them all together until a clear picture begins to form. And this, right here, is the ultimate payoff. This is the big reveal. All of those questions, all that digging, it wasn't just to fill out a chart. It was all raw material, used to build a treatment plan that is 100% personalized for you, not for some textbook, generic patient. So let's just quickly recap that whole investigative process. It all starts when the detective reviews your file, your personal history. Then they identify any lifestyle accomplices. After that, they follow the genetic leads from your family and they uncover the physical clues from your symptoms. And all of that leads to the final, crucial step: creating a targeted action plan. See? It's a logical process where every step builds right on top of the last one. And when you boil it all down, that's what your medical history really is. It's not just a bunch of dates and names. It's your story. And in the case of your health, it is, without a doubt, the single most powerful tool your doctor has to help you get your blood pressure managed for good. So, as we wrap this up, I want you to think about this. In this whole investigation, you are the most important person in the room. You're not just the subject of the case, you're the star witness. You hold all the crucial clues. So the next time you're talking with your doctor, remember that. What's the most important clue your testimony is going to reveal?